So my name's Katherine Leighton. I was the Simulation Fellow at the Scottish Sim Centre last year, and this is a bit of work that I did whilst I was there with some of my colleagues. So we know that acute stress can be detrimental to clinicians' performance, and certainly in other high-stake professions nowadays there's quite a lot of focus on stress management training. And with this in mind, in our study we looked at whether a brief stress intervention before junior doctors went on to have a simulated medical emergency session could influence their stress levels and have an effect on their performance during the simulations. So we had a total of 33 core medical trainees who were attending a one-day high-fidelity simulation course. And these trainees were randomised either to receive our standard course, which at the moment doesn't have a focus on stress management training. And then the second course that the other half of the trainees received had teaching first thing in the morning, looking at brief stress interventions, and then they went on to have the same course. We measured stress in a variety of different ways, so we looked at subjective stress by asking them to all complete a questionnaire at the start of the day and then immediately after their 15-minute scenario. We also asked them to rate on a stressometer how stressed they felt between 0 and 10, and we had a nursing confederate in the scenarios who rated how stressed they thought that lead doctor was. And then for objective stress, we looked at heart rate variability, so we had them wearing a sports watch and chest strap that has been validated for heart rate variability. And what we looked at was the ratio of low frequency variability to high frequency variability. And essentially the higher that number is, the less parasympathetic tone the doctor is experiencing, suggesting that they're more stressed. And then looking at performance, we looked at whether they got the correct diagnosis, whether they instituted the correct management, and actually how long it took them to make that diagnosis and how long it took them to call for help. So in terms of our results, what we found was with the questionnaires, stress levels were higher in the doctors who did not receive the training on stress management. And when we looked at heart rate variability, again we found that there were lower stress levels in the doctors that had received this training in terms of the stress management techniques. And then in terms of performance, this was actually quite interesting. The doctors that received the training on stress management actually took a little bit longer to reach the diagnosis. And interestingly, it took them about 2 minutes extra to call for help. So in summary, junior doctors attending simulated medical emergencies that have training incorporated into that about stress management appear to have lower objective and self-assessed stress levels. We need to kind of follow this up with a further study with a larger number of participants to see if we can confirm our initial results, and also to see if we can replicate this in the workplace as well. Thank you.